the internet.
Hi guys, my name is Kelsey McDonald and I'm a junior nursing major from Naperville, Illinois. I'm just here to tell you, me and Mark are just here to tell you a little bit about our experience here in the Bradley Simulation Lab.
And my name is Mark Reisman. I'm a senior nursing major here at Bradley University. Can't wait to show you guys this tour. I will preemptively tell you, first of all, if you have any questions, feel free to write them in the right or on the right side of your screen. Let us know, and we're free to answer questions throughout this tour. The other thing is we're having a little bit of trouble with our Wi-Fi this morning, so if we cut out, we'll be back as soon as possible, okay?
Come on guys, let's go check it out.
So this first room that we go into has a setup kind of along the wall like a doctor's office, and everything that we do in this whole area is set up differently for different situations that'll arise during the nursing years. But here in the doctor's office we learn assessment skills, basic assessment, like a whole head to toe assessment. So you go through your neuro assessment, you do respiratory assessment, cardiac, a little bit of everything. You learn how to take vital signs. So
Hey Mark, want to take my blood pressure?
We'll do a blood pressure, we'll do all sorts of stuff like taking your pulse and respiratory rate, all that stuff gets done here on each other. So, you know, you get this practice early on in your nursing career so that you're a little bit better at it as you go on through the years.
And the funny thing is I remember when I first was in here as a sophomore learning how to take blood pressure, and I could not hear a heartbeat. I was like, oh my gosh, I can't even get blood pressure down. But now I'm starting IVs, catheters, and all kinds of fun things while I'm currently in my OB and Peds rotation.
You're 120/90.
That sounds about right. So the cool thing is here we get to use all the same equipment we would use in the hospital and really just get comfortable with the equipment as we're moving into the hospital, so we're not like fumbling around with certain things, you know.
You just kind of get to build your confidence up here. You know, it's nice to talk about it and to read about it and see all these things in books and videos, but you really don't truly get the experience until you're hands-on. And here in our lab, that's all we do is get hands-on.
So if you guys want to follow us this way, over here we just have, so each year, each semester, we'll get a different skills, lab skills bag with different, you know, things, materials that we're going to need for the semester. So obviously as you move throughout the years, you're going to get different materials, different things that you're going to need. The same, pretty much the standard things you get every year is, you know, IV start kits, IV tubing, catheter kits, just to practice and refresh on those skills at the beginning of every semester.
And like I said earlier, you know, it's different every year. So here at Bradley, we do 3 years of clinical. So we're getting in here in the skills lab. We get into the hospital starting our sophomore year. Sophomore year is when you get the skills bag that has the IV and the medication administration kits. So you really, I mean, you're playing with needles even your sophomore year. And here in the skills lab, we get to do it safely, and we get to learn with a hands-on experience, which is an awesome thing for us. Which is actually interesting. We're giving you guys this tour right now because there's sophomore students learning how to give it medications right now. We're going to peek in there. Right here is a bathroom, kind of set up just like the hospital bathrooms. Basically the point of this, first of all, we're using it for storage right now. These are our arms that we start IVs on. But it also gets used to, you know, because you're going to be in a bathroom. At some point in your nursing career, you're going to have to help a patient, first of all, safely get onto a toilet. These are patients with neuro or musculoskeletal deficits that you have to help out and get them up and move them over onto a toilet. And so here, when we come into our lab, we get to truly experience that. Let's go check it out.
So here, like Mark said, we have some of our sophomore students. They're currently working on drawing up medications. So sophomore year, especially the beginning, is focused on medication administration. So as you can see, we have our instructors here, and we also have another group back there, and they're just perfecting their medication administration skills. So a lot of the basic stuff we start off with, but this is the important stuff that we really need to make sure our students are learning how to do properly and really doing it right.
The other thing we have in this room, first of all, we have all the needles that they use for medication administration, where they teach them how to draw up a med, how to start an IV. But if you look around the outside of the room here, we have these lower simulation mannequins. These mannequins get used, and there's different things set up for each one. As Kelsey's going to model, this one is for subcutaneous injections. But each one of these mannequins that lines outside of the room is used for different things to teach us different skills. So this is the subcutaneous injection. We have IM injections next door. There's one that's set up for catheters, one that we can put NG tubes into patients, all sorts of different skills. And each one of these is adaptable so that you can change them to do different things throughout the semester if they need it to teach us different skills.
So going off of what Mark said, we have both male and female mannequins, and that's especially important for catheter insertions because obviously males and females are a little bit different. So we do have males and females, and we also do have a pregnant mom so that you can feel the fundus, which is something that is very important in your OB assessments.
Another thing I wanted to mention while we're in this room, we actually have these 3 wheelchairs set up over here. The significance of those wheelchairs is not only in that we get to teach proper body mechanics and how to lift and move and turn and help patients that are using wheelchairs, a lot of these being paraplegics or patients who aren't able to use their legs. But we also consult, we have a Doctor of Physical Therapy program here at Bradley University, and our physical therapy students and instructors will actually come down and spend a day with the nursing students and teach us proper body mechanics. So first of all, we're not hurting ourselves, but we're also not hurting our patients when we get them up and out of the wheelchair. Grab a pair of gloves here.
Well, Mark's grabbing a pair of gloves. I just wanted to point out something we have back here. We have some of the sophomore students, they're working on a safety project. So their job here is to identify what things are unsafe. So for example, the position of the bed. The position of the bed should always be at the lowest position for the patient. Side rails, all the side rails are down. Just how the cords are tangled. So their job is to identify all those things that are unsafe for the patient. So one of the main goals in our skills lab is to really focus on safety. This is a safe place to learn, learning what's right and what's wrong, and really learning how to determine and, find those situations in the hospital and your clinicals that look unsafe. So as a nursing student, as a nurse in the future, our job is to always, make sure that everyone is safe, our patients, ourselves, our colleagues. So safety is obviously something that's really important to us here. And it looks like Mark's going to actually start an IV for us. So
I put on a pair of gloves because this is one thing that I like to do. A lot of people get terrified of starting IVs. And here, first of all, we don't practice on each other as students. Excuse me. Instead, we practice on these arms. And what we do is they've got all these arms. You saw them when we were in the bathroom earlier. But what you get to do is you get to come in and, first of all, it's set up, it has the exact same veins, first of all, that I have on my arm. And these blood bags over here run through the arm. So when you put a needle in, you still get flash and you get blood return just like you would in a real patient. What that allows us to do is get experience, first of all, working with a needle, so you get comfortable with it. And it just really creates a good learning experience because you know exactly what you're going to do, you know what it's supposed to feel like. It's just like starting an IV on a real patient. Big stick here. And there we go.
So as you can see, we still get that flashback. So we use food dye to simulate, that blood. So we do see that's something you would always look for when you're starting an IV with a patient is that blood return. So this we do have, as you can see, the red fluid, and you're able to see that you were successfully able to start an IV here.
So once I get that IV in, take my Tegaderm off. Pop my tourniquet, thank you, Kelsey. And we can see if we have flush, just like a real patient. And it flushes right in. All right. You guys have any questions? All righty.
All right, so next we're going to go to one of my favorite things in our simulation lab here. We have simulation mannequins. So actually we have one of our professors right here.
Hi everyone.
And she will sit in the control room. So the control room is where our teachers sit, and they can see everything that we're doing, but we're not able to see them, buttons they're pressing, and things like that. So
yeah, truly this is my favorite part of the simulation lab. Everything else you get to practice basic skills. You practice on each other with basic assessment. But here, and we'll show you the mannequin here in a minute, you get to truly experience what it's like to be the nurse in a situation where you have an actual patient. So just a peek in here. Amy will talk a little bit about what's going on.
So what we do here in the control room is we run the mannequin. What we've got is some video capabilities so that we can not only watch what the students are doing, we can see through the one-way mirror, but we can also record what the students are doing, and so they can visualize what they've done in the simulation after it's complete and talk about things that they did well, things that maybe they would improve upon, or things that they would do differently. And so with this computer, I can run the mannequin. We can change different variables with the mannequin. We can change their blood pressure, heart rate, so on and so forth. We can talk through the mannequin, and so they have a voice. And maybe what you can see through the one-way glass, I'm not sure if it's going to come through, is that we can be the mannequin. So there's Mark. How are you guys doing today?
Good.
Okay, make sure you're checking out your patient. So your patient's complaining of being sick. Oh, I just feel terrible.
Feeling sick?
Yeah.
What's going on? Have you gotten sick at all today?
No, I haven't thrown up.
Okay. Is there anything that we can do for you right now?
I'm really thirsty.
Okay.
Thirsty? I don't think we're going to let you have anything to drink until we see one of our doctors, okay?
Oh, all right.
But as you can see, we get to actually talk to the patient. He talks back to us. It's not just Professor Grugan talking to us. We have an actual monitor which shows, this is essentially exactly what you see when you're in the hospital. It's got heart rate and arterial blood pressure, capnography monitoring, everything that you see basically right in the hospital here on this patient. He's breathing. I don't know if you're seeing chest rise and fall, but he's breathing. We can check a pulse down here in his foot. We can check a pulse up on the radial area. It's awesome. He can even sweat. He does all these really cool things that we get to, truly experience what it's like to take care of a patient. And it makes all the difference when you actually get in. Say, first of all, we have a simulation where you have a med error or a med, a med reaction, a problem where, this patient could die. First of all, we get to act as the nurse. We are the first ones on hand. We're the ones where, if you're in the hospital and you have something where there's a medication reaction or some kind of an error like that, the doctors and the nurses in the area are going to take over and you kind of stand off to the side. And that's just kind of how clinical works, The best part about being here is, first of all, this is, of course, not a live human being, but we get to have that real experience. So Professor Grugan has put this patient into ventricular fibrillation, so we would attach pads and start CPR and shock them, but thank you, Professor Grugan. She's killing our patient right before your eyes, and that's one of the cool things. Look, and he cardioverted himself out of VFib. Wonderful. One of the great things that we get to do is, you have patients that can code here in our lab.
And it's always great to be exposed to those situations here where you're comfortable, you're not being graded, it is a learning experience. So like Professor Grugan was saying earlier, we talk about all the things that afterwards that we did well and things that we can work on and improve on. So if we are faced with these situations, in clinical, we're prepared and we're not nervous like sometimes we might get here in our simulation experiences. So.
Yeah,
it's a great learning experience.
It's a great experience because, it's not like we're getting graded where they're going to get, upset and you're going to fail a class. It's here. They understand that you haven't experienced anything like this before, and they're here to help you and help you experience the situation and help you learn.
So, this is our adult simulation here. We do have a PED simulation lab, which is really neat because obviously, as you guys may know, infants and children are a lot different from adults. So it's really important to not only learn in class about our pediatric and infant population, but to really perform and get that experience here in our simulation lab. So I believe we have a simulation group going on here. So if you guys want to come in and check out what we do in our simulation experiences. So as you guys can see, they're in their gowns, their masks, and they have gloves on. That is kind of simulating the experience here where our patient is in isolation, so they're acting just like they would in a hospital setting, so they're wearing their appropriate protective wear. And we have the mom over here, and then our nurses here, so documenting. Some nurses over here, you know, helping the baby, and then we have our professor back here who's kind of monitoring and watching what the patient or what the students are doing well, and just kind of taking notes on what's going on here.
Why are you suctioning the baby?
Because she has secretions and they're getting
So
stuck in her
this is
throat.
acting as
So we
mom
have
here in the
suction
corner.
off,
So
she
what
doesn't
she'll do is ask questions and kind of, you know, make it the simulation as real as possible. So she just asked, why are you suctioning the baby? And you know, of course, she's just trying to make everything, like I said, as real as possible. You know, that's the whole point of the simulation, is to get in and have that hands-on patient experience that you wouldn't experience otherwise. All right.
So this is our PEDS simulation lab like we just talked about. So as we finish our tour here, if you guys have any questions, feel free to type them in. Otherwise, it was really great showing you our simulation labs, and I hope you guys got to see a little bit of, you know, what we do here at Bradley as nursing students.
Yeah, I hope you enjoyed the tour. If you have any questions, let us know.